What is up? Thank you for coming back. We've got a good video today. Little warning there by second thought. Why American healthcare is the worst. We are the worst. We are the worst in the developed world. At least according to this dude. Let's see if he can convince me, you know? As an American, I gotta say, I don't mind paying $300 an hour for a hospital bed and $50 for a pill of Tylenol in the hospital. This is fantastic to me. What could possibly be better? Let's see.
I wonder if you could tell me how expensive you think calling an ambulance out to your location is in America.
I mean, honestly, it'll set you back like 3 or 4 G's, grand. Yeah, something like that.
Is there a price for that?
Yes,
Jeez, $100? $100?
$2.5 grand.
For what? Why?
They billed
Yeah,
our
dude.
insurance company over $3 million.
You really can't make that up, can you? How freaking... That isn't... You're in desperate need of your life is in danger. You're dying on the street. And they pull up, yeah, that'll be $3 grand. Right this way. Come on in. You know, it's just... Now, of course, they don't say that. They pretty much just take you and then send you the bill after the fact. But, I mean, I know people who have said no to ambulances. My dad is one of them, you know. The ambulance, he fell off his motorcycle, ambulance pulled up, and he's like, no, can't afford, I'm not paying that.
$1 million for the cost of transplant. I don't know what people do without insurance. How could you even begin to pay that?
She said the bill is up to
It's insane, dude.
$80,000 already. And she said, Mrs. Weinkauf, I hope you realize that you're responsible for this bill. I thought, what am I going to do? I've worked my whole life. Is this how my life is going to end?
In a previous episode, I briefly touched on the failures of the American
Mind-blowing,
healthcare system.
dude.
That section of the video prompted all sorts of responses in the comments, mostly from Europeans who were horrified to learn that Americans have to pay for an ambulance ride to the hospital, but also a handful of brave patriots who claim, without evidence, that the American healthcare system is the best in the world.
Now, I will say, to my man here, if I had to defend my man here, which I don't, the cost and the fact that there's not nearly enough social help from the government, that's one side. But the actual quality of the care, put aside the fact you're paying $50 for Tylenol. The quality's good.
This video is for those people. Let's jump right in. I'm
If you
going to
can
throw a bunch
pay.
of statistics at you, and then we'll look at the root cause of the problem. America spends more money per capita on healthcare than any other nation on Earth. You
Yeah,
would
like triple.
think that this expenditure would guarantee the best care in the world. That is not the case. In fact, despite being the most
Now, I will say, our healthcare here is very good, and it's very good in, well, what I mean by that is the quality is very good in certain aspects. That's pretty much just a fact. It is good in certain aspects. Now, certain other aspects, other countries blow us away. Life expectancy, stuff like that, where it's like the general population, blow us away. But if you look at like the top of the line surgeon or something, you know, there's a decent chance that he might be an American, but you got to pay top dollar to go to that guy, and nobody gets to go to him unless you're rich.
expensive healthcare system on Earth, consuming over 16% of our GDP, it's one of, if not the least effective in the developed world. We spend over $10,000 per capita on healthcare, and not only is the quality of care subpar, we don't even cover
Career.
everybody. Compare this to places like Germany, who pay drastically less per capita and guarantee coverage to all their citizens.
That's so
there
embarrassing.
were over 27 million uninsured Americans in 2018, and that number will have skyrocketed in recent months, thanks to the millions of layoffs across the country. Even before the epidemic, we had more uninsured and underinsured citizens than any other developed nation. In addition to not covering a large portion of the population, even those with excellent, by American standards, health insurance struggle to pay medical bills. Over 25% of insured people reported having difficulty paying for the exorbitant.
Dude, that's because the insurance here is home. That makes me even more mad than like any part of it. I'd almost rather not have insurance, because the most infuriating part is when you go to you finally use your insurance. I barely ever go to the hospital or the doctor. You finally go because you need to. And the insurance is like, oh, well, we're not paying for that because that part was outside of your network, and then this part was elective, and then this part, you haven't even come close to reaching your deductible yet. And then once you do reach it, we'll pay for like 75%.
Exorbitant cost of their treatment. Of this group, 63%
insane.
had to pay most or all of their
Insane.
savings to cover the medical bills, and 42% had to get a second job. Life-saving drugs in America often cost 10 times what they cost in other countries. For example, in Canada, one vial of insulin costs $32. In the United States, the same drug from the same factory costs $300. And that's not even an extreme example. Take the HIV drug Truvada. In Australia, it costs just $8. In the United States, it costs $2,000, despite US taxpayers footing the bill for its development.
Dude, Australians, if you want some bootleg like career, some other people are sneaking like drugs across. You can just sneak some HIV drugs, but go get them for $8 a pop. Sneak them over the border to those HIV patients.
Every year, over 500,000 people go bankrupt trying to pay their medical bills. In a country where 40% of the population can't afford a surprise $400 expense, an ambulance ride to the hospital will cost you more than twice that amount. And all of this is happening in the richest country on Earth. If we have the resources, and we're so much better than all the other countries, why is our healthcare system so broken?
Because it's fueled by greed.
Here's the thing. It's not broken. It's functioning exactly as you'd expect it to.
Exactly.
America's healthcare system is for profit. That means instead of providing care because it's the ethical thing to do, they only do it because there's a big check involved. Back in the 30s,
Well, the problem becomes that people need care. They need care. You don't get to, it's not like normal capitalist society where you get to go, oh, you're selling bread for $5. I'm going to go over here because it's $2. Not really. They don't even tell you the cost when you're in the healthcare setting. And when you're there, you probably are pretty desperate. You don't have time to go around shopping. Oh, well, you can fix my broken arm for $300 less. Like,
Blue Cross and Blue Shield were the two main health insurance providers in the U.S. In those days, they operated as nonprofits and wouldn't turn anyone away for any reason. Then, after World War II, employers started offering health insurance as a benefit, and between 1940 and 1955, the percentage of insured Americans jumped from 10% to over 60%. This new demand for health insurance caught the eye of many business people, and the for-profit healthcare industry was born. By 1951, big names like Aetna and Cigna were major players in the industry, which continued to grow through the 70s and 80s. In the 80s, the country began to see its first for-profit hospitals, operated by large investors who owned multi-hospital chains. By 1981, 1 in 7 hospitals in the US was for-profit. Suddenly, medical bills became a lot longer and more convoluted. Every little thing became an itemized expense, from tissues to plastic cups to being able to hold your baby after it's born. The hospital's transition from philanthropy to corporation was complete. This is not normal in other countries. America had taken the intensely cruel step of taking something sacred, the health and well-being of its citizens, and slapping a price tag on it. With this commodification of health came unsurprising side effects. Average American life expectancy is lower than other wealthy countries and has actually begun to decrease in recent years compared to other countries slowly increasing. The U.S. has the highest infant and maternal mortality rates of any developed country. The U.S. has higher rates of medical errors than other countries. Adults in most other comparable countries have quicker access to a doctor or nurse when they need care, contrary to what American healthcare advocates would have you believe. To make a long story short,
that is one thing that people harp on. Like when they're trying to pass any kind of healthcare bill, they're like, but if you have a broken arm, you're going to have to wait for 2 months in the waiting room. Because everybody will have health insurance. No, I want to have it, just me, so I don't have to wait.
In just about every study on the effectiveness of healthcare systems in developed nations, America scores very poorly, most of the time at the very bottom of the list. And other nations are taking notice. Towards the beginning of the coronavirus epidemic, one university in Norway urged its students to come home if they were studying in countries with poorly developed health systems, such as the US. Part of the problem is the American obsession with streamlining or optimization. Anything that doesn't immediately increase profits has to go. Take, for example, the practice of so-called just-in-time delivery of essential equipment such as ventilators. Instead of having an emergency stockpile, including personal protective equipment such as masks and gloves, these items are instead delivered only when the need arises. The idea is to reduce overhead, but in reality it leaves us totally unprepared and under-equipped for a national pandemic. That's why we see pictures of doctors and nurses wearing trash bags, because their hospitals haven't provided adequate protective equipment.
That's
And
facts,
just to
dude.
be safe,
That's true.
they're firing
That's
people
not
who post
fake.
those kinds of pictures. To their credit, the CDC was planning to address the national shortage of ventilators, but the company to whom they had given the contract was bought out by a larger company, who canceled the project because it wasn't going to be profitable enough. And of course that larger company's name is Covidian, because the architects clearly put an intern in charge of our simulation. I could spend all day listing off instances of absurdly high medical bills, but at the end of the day, some people in America will still defend the practice of for-profit healthcare. Maybe the best way to get through to these people isn't to show them the bills, but to show them what people in other, saner countries think of the bills. So here you go.
Yeah.
Ambulance call out. How much do you think that costs?
Zero payment.
Zero payment.
Yeah, zero payment.
No, because $2,500.
For real.
An inhaler.
$100,
Yeah, you're pretty close. It's a bit more.
120
250 to 350.
for an inhaler.
So 2 EpiPens. How much do you reckon they are?
$80.
600.
600.
It's like that with everything in healthcare here, dude. I mean, it's completely true. Your mind would be blown. The amount, I mean, you have to pay for the time you spend in the hospital, dude. It's like a freaking hotel. Except it's the most expensive hotel you've ever stayed at, with the worst food.
$100. What? Why?
100, 200.
Dollars.
Yeah.
The average is about 10 grand. It can go up to 30,000.
10 grand for a baby.
It's okay to laugh. It's a
Yep. Hey, check this out. We got one coming. Luckily, our insurance is not bad. So, out of pocket, I think we're paying like $1 grand. It's like, because our insurance is not bad,
It's a funny
which is still obviously like silly.
video. But these are the types of reaction you get when you explain to anyone in a first world country besides the US just how screwed up our healthcare system is. We're not
My wife is pregnant, by the way. There's no baby in there. The baby's coming. That's why I guess I didn't say that.
paying these exorbitant fees for quality care. We're paying for executive bonuses, shareholder value, and lucrative contracts. Pharmaceutical and medical device companies can charge whatever they want, and the US government will never step in. We're one of the only nations on Earth that doesn't regulate the cost of drugs and medical supplies, and companies negotiate directly
are
with
the worst.
hospitals and insurers to get the best terms. Not best for the patient, best for them.
Heck yeah.
Drug costs in America are many times higher than in any other country. Why? Because that's how it works in a for-profit system. The dollar holds infinitely more value
Well, when you're talking about drugs that people literally are going to die without, they're going to die without the drugs. How much would you pay for a pill that you needed to live? It's not fair. Like, that obviously, it's very silly. It shouldn't even be a debate. Like, that's obviously stupid.
to these corporations than human well-being. The needs of the people are secondary to the profit motive. The American healthcare system is a system that relies on people getting sick and coming in for treatment, which is why we don't see any investment in public health initiatives. A program like Medicare for All would likely solve this and every other health problem produced by the coronavirus pandemic. Everyone would have been able to see a doctor and get tested, which would have given us more.
A big problem with the pandemic was that tests were in really short supply at first, and I don't know. I'm just saying other countries had tons of problems with COVID. So to say it would have, if we had Medicare for All, that would have fixed COVID. It would have made it better. I'm sure.
Accurate data
Sure
about the
that.
illness and its spread. Hospitals wouldn't have to waste energy dealing with private insurers and fighting them on every little thing. And with the profit motive removed from the healthcare
Every little thing you have to fight. You have to fight for, even though you pay hundreds of dollars.
equation, the government
My wife is screaming. I think she saw a bug.
would have an incentive to prioritize public health to prevent people from getting sick instead of counting on it. That in turn would make us better prepared for the next pandemic. But remember, the system that we have isn't broken. It's functioning exactly as it's meant to. Why do we pay so much money for the worst care in the developed world? And more importantly, why do we...
Hello. You're on video.
There was a fucking spider. And it came out of the
Hey,
garbage.
no cursing on the video. That'll get me demonetized. Okay, let me finish this. Let me finish this, and I'll come kill it.
we put up with it?
I'm not
If you'd
editing
like
that
to
out.
learn more about the virus that made it clear
I don't. I'm not.
just how ill-prepared the U.S. was for a pandemic, I highly recommend you check out the coronavirus epidemic on Curiosity
There she was. Did you see the belly? Baby's coming next month.
Stream. It's a fascinating look at how the... I highly recommend you check out the coronavirus epidemic on Curiosity Stream. It's a fascinating look at how the world responds
How are you getting paid to tell me that?
to a rapidly spreading virus and the measures we can take to stem the tide of infection. If
No,
you
really,
watch my
are you?
videos, you'll know I'm a big fan of Curiosity Stream.
Oh,
It's an
yeah.
online
He
streaming
is.
service
So we're not going to listen to that part. You can go watch his video if you want to watch the ad. But I do appreciate his video. Second thought, that was an epic video. I enjoyed that. Obviously, I'm an American, so I knew that we're getting the you know, I know what we're getting. But hey, sometimes it's good to see how other countries are treated so much better and don't have to pay $3,000, and how shocked they are to find that out. And that we pay that much. Oh my gosh. Anyway, thank you guys for watching. Sorry about the little interruption. She's okay though. She's allowed to be afraid. She's pregnant and there was a spider. I'm gonna go kill the spider. I hope to see you guys again. I hope you subscribe. I hope you just come back, you know? I hope you come back. But have a great Arvo. Have a great afternoon. Goodbye.